Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. The holiday season can be a joyous time of the year, marked by good food, celebrations with family and friends, but it can also be a very hectic and stressful time for many people that are suffering with mental health conditions. Our guest this morning is Dr. Jessica Whalen, and she's going to talk to us about the holiday season and how it can be particularly challenging for people living with mental health conditions. Welcome to Health Professional Radio, Dr. Jessica Whalen.
Hi, yes, thanks for having me. I'm happy to be here. In fact, 64% of people with mental health conditions do report that the holidays do, in fact, worsen their mental health. And so I definitely see this amongst my own patients. And I'm usually telling them that this is psychiatry's busy season. And so I'm grateful to be here today as a compensated spokesperson on behalf of AbbVie to discuss this topic and hopefully help others to be able to differentiate between things like the holiday blues and other conditions like bipolar I disorder.
The holiday blues. What is it about the holidays that gets people blue who aren't suffering with mental health conditions?
Well, I think it's actually the stress that's causing people to feel like they are undergoing a condition that's not actually a diagnosable condition. So it's those emotional turmoil, probably staying up late at night, not really caring for themselves very well, as opposed to having a diagnosable mood condition.
Just the stress of the holidays, trying to get things organized, maybe that party, whatever, is causing some of the holiday blues. Maybe not being able to be with loved ones for the holidays is causing holiday blues. But folks who are dealing with actual diagnosed mental health conditions, their situation is much more serious, right?
Definitely. And, you know, we're dealing with more factors, biological factors. This is going to go beyond, you know, just the holidays. So it's not just the stress. Bipolar disorder, which is a condition that can cause, is characterized by unpredictable high and low mood swings. The low mood swings are depressive episodes. Those can lead to patients frequently getting misdiagnosed as major depressive disorder because the symptoms overlap with major depressive disorder. And so they will go into their practitioner complaining of symptoms of hopelessness, fatigue, extreme sadness, having little interest or pleasure in their hobbies, changes in appetite. And so they'll commonly get misdiagnosed. But bipolar I disorder is characterized by also having manic symptoms. And so this is unique to bipolar disorder. And so patients will also have these symptoms where they may have difficulty finding sleep that they're needing to have, or they may have racing thoughts, they may have increased irritability, they could have impulsive risk-taking behaviors. In some ways, this could be increased spending, which during the holidays would be problematic because we may be spending money that we don't have.
Could the same thing happen during Halloween shopping or planning a birthday party for yourself or someone else? Is it simply the stress of added activity or a special time of the year, any time of the year, or the holidays particularly problematic?
Well, I would say the holidays are an exacerbator. So, and I think that's kind of what the statistic was saying. So patients with mental health conditions are just more prone or sensitive to being affected with their mental health conditions. But those of us without mental health conditions are still we're prone to stress. But I think individuals, if they're concerned that they might be struggling with a mental health condition, should open that dialogue with their healthcare practitioner, because I think it's easy to misdiagnose oneself or write themselves off saying, oh, it's nothing, it's just the holidays that are stressing me out, when they may be actually struggling something, because we could jump from one thing saying, oh, it's just my kid's birthday, oh, it's just this, when really maybe there are a series of episodes that they're having.
What about the numbers concerning new diagnoses during the holidays. Obviously, practitioners have patients that they're going to, they're used to seeing them during the holidays because their stress levels, their bipolar goes into high gear during the holidays. But what about people who are talking to a physician for whatever reason, and then they're diagnosed with bipolar 1 during the holidays? Is that something that you see a rise in, new diagnoses?
Definitely. I feel that I think more people do come in to get help. I've seen this during holidays, even before I became a practitioner. Some of it, I think, is because when we're around family, maybe they get urged to get assistance with getting care. And I think that kind of leads into some of the things that I'm always recommending to my patients to help manage their symptoms. Is in my practice, there's a lot of things that I'm recommending that can help. Mindfulness things can help patients with bipolar disorder, like filling out mood charts. And I actually recommend that they get help with their family, because the family can sometimes help them recognize symptoms even before their mood starts to go themselves. And practicing self-care, trying to get good sleep is very important, trying to get those 8 hours, not working 16-hour days. I know myself, I could even be better about that. And getting on the right medication regime is exceptionally important. I know for my patients in my practice, the medication that I've seen be very helpful in treating the full spectrum of bipolar symptoms has been Vraylar or cariprazine. This is an FDA-approved medication for adults to treat depressive episodes for the short-term treatment of manic or mixed episodes with bipolar 1 disorder. But something very important to consider with all medications is to consider side effects and safety risks. It's not indicated for patients with dementia-related psychosis. So with the elderly, always having to keep in mind to watch for increased risk of stroke. And with children and young adults, we always want to make sure that they're reporting increased suicidal thoughts to their practitioners. Any changes with stiff muscles, body movements, metabolic changes, or GI changes, or stress. For safety and side effects tools, I usually refer patients back to the website. They could go for the medication. They could go look up information on www.vraylar.com for that particular medication.
Well, Dr. Whalen, I appreciate you joining us here on Health Professional Radio this morning. Hoping we'll speak again.
Yes, thank you so much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Jessica Whalen. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen and download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.